Now let's turn attention to coronavirus, because the Ghana Registered Nurses and Midwives Association says one of its members has died out of the disease after 87 of them tested positive to coronavirus. Now this follows exposure of some 820 of them while on duty. Now, in the situation, the association is also blaming on inadequate provision of personal protective equipment by their employers, the Ghana Health Service. An emotionally charged secretary of the Nurses and Midwifery Association tells JoyNews that nurses are being gagged by health facility managers while pregnant, and new mothers are also being forced to work despite the ongoing pandemic. Well, here is the General Secretary, David Tinkranchum.
We know that about 820 people have been exposed to the virus, and then out of that, 87 people have tested positive. We have lost one, and 422 also tested negative and they've been discharged home. As I indicated, eight have recovered, and then 312 have been quarantined and either in self-isolation or whatever. Some of them are in facilities in various parts of the country. And this is what we've been talking about all this while. Right from the beginning, we made it clear that the concentration shouldn't be only at the COVID centers. But let me add that so far, the 87 people that have been infected, 2 were from the COVID centers, or if you like, the designated treatment centers. Okay. But the rest of them are all from the periphery. And that's why we kept saying that we should provide the necessary logistics for those at the periphery who are more at risk. I can tell you that it's not like the nurses are not taking good care of themselves. In fact, the figures could have been more than this, but for the way they are trained and all that. The only thing is that they don't have the logistics at the various peripheries to be able to take good care of themselves. The PPEs are something that must have constant supply. Okay, it's not like most of them are disposable, okay, and something that gets disposed of after single use, you must have constant supply. We have gotten information that nurses and midwives who are given or speaking out about some of these issues are being gagged, and we want to sign a note of caution to any management of any health facility who would dare gag any nurse or any midwife, because we are not here to see to the demise of nurses and midwives. Leadership will not take kindly to it at all. They don't have access to PPEs. And then when they complain, management have the cause to, speak to them in a manner as if, they think that when you report, then you are tarnishing the reputation or the image of the hospital. Meanwhile, the life of the nurse is more important than the reputation of that hospital.
True.
All right? I have accounts where even a medical doctor was reprimanded simply because he spoke about lack of PPE. We will not sit down for our people to be infected. And because we are not soldiers, it is a soldier who swears an oath to protect the territorial integrity of a country at the expense of his life. We didn't swear any oath to protect the life of people at the expense of our life. We are prepared to fight this infection, but not at the expense of our life. That must be made clear.